afternoon. Once again, I am happy to have a session so that I can be able to create awareness on some of the common problems that affect us in our setting. Today we are going to discuss the condition called osteoarthritis. It is among the non-communicable diseases, also called lifestyle diseases. My name is Mrs. Jacqueline Mobi Mogo. I'm happy to discuss or talk about this condition today. My area is community health or public health. This condition, the request to discuss this condition was by some of my friends who are in Nairobi, who requested for me to share with them so that they can be a little more informed about this condition. Osteoarthritis is a chronic degenerative disease of the joint. It affects the whole joint, including the tissues around the joint. It commonly affects the knee joint, the knees, the hip, the spine, and the joints of the heart. Osteoarthritis causes pain, swelling, and joint stiffness. So a person who has osteoarthritis is likely to suffer from pain, swelling, and stiffness of the joint. It also affects a person's ability to move, so the person may not be able to move very freely when a joint has been affected. Osteoarthritis occurs worldwide. It's a common problem occurring worldwide. In 2019, 528 million people were living with the disease called osteoarthritis. Among those affected, 73% of the people who had osteoarthritis were aged above 55 years. And unfortunately, 60% of the people who suffer from osteoarthritis are women. The knee joint is the joint which is mostly affected. It is followed by the hip joint and the hard joint. What are the factors that contribute to development of osteoarthritis? Some of the factors that contribute to development of arthritis is history of injury to the joint. Maybe a person may have had a fall or an accident where the joint was injured. The other is overuse of the joints. Our friends who are more involved in activities such as athletes are more affected because they tend to overuse their joints because of the extra activities that they do to become athletes. The other factor is old age. When a person becomes a senior citizen, then osteoarthritis can creep in. The other factor associated with osteoarthritis development is overweight and obesity. We have talked about overweight and obesity, and we shall talk a little more about it a little later. What are the signs and symptoms of osteoarthritis? One is pain on the affected joint. The joint is also likely to be swollen, and the person has a problem using that joint because it is difficult to move that joint. So activities that require the person to move the joint becomes more difficult. The muscles surrounding the joint are also affected, and they are affected because the strength of the muscles around the joint become weak because of not using the joint as it should be used. The other is reduced ability to perform daily activities. For example, if it is a woman who wants to do some activities in her house, she may not be able to move easily to carry out activities. Also, the other factor that is affected is the person may not be able to do a walk easily because of the painful joints. Symptoms can develop slowly or they can start quickly, especially if a person has had a recent injury to the joint. Osteoarthritis changes are progressive. Once they have started, they slowly continue to increase with time, and gradually the person can go through very difficult and challenging times, especially in terms of movement, and can end up with what is termed as severe osteoarthritis. Severe of osteoarthritis makes the joint not usable, so the person is having pain almost continuous, long-term pain, and is not able to use the joint. That can cause a person not to be able to move about. Osteoarthritis affects quality of life in a person, causing a person to have difficulties in sleeping. It can affect the mental status of a person. You are not able to contact your friends easily. You are not able to walk to your friend's place or to visit your friend, and therefore that affects your mental status and your relationship with people who are your friends and so forth. What are the causes and risk factors for developing osteoarthritis? The risk factors for developing osteoarthritis is injury to the joint. Injury to a joint. For example, a fracture. A fracture or injury to your joint can occur because either of an accident or a fall. The other is pre-existing joint diseases. For example, rheumatoid arthritis. If the joints are already affected by another disease, then osteoarthritis can occur. The other is presence of other diseases. For example, diabetes mellitus. If a person already is suffering from diabetes mellitus, osteoarthritis can come in. The other factor is overweight and obesity due to excessive overload of the joint. When a person has extra weight, which is termed as overweight or obesity, the joint is carrying more than it should, and therefore there is damage to the joint. The other is hereditary. It may probably occur because of within families, because of hereditary factors. It is therefore important for you and me to keep our weight within the normal body mass index. What is body mass index? Body mass index is an index which is used of weight for height. It is used to classify overweight and obesity in an adult person. BMI is calculated as weight in kilograms divided by the square of height in meters. That gives you a figure, and the figure helps you to be able to find out whether you fit in within the normal body mass index. The categories of the body mass index in adults is 16.0 to 18.4, that is considered as underweight. 18.5 to 24.5 is considered as the normal weight. It is important for you and me to fit in within the normal body mass index. When the weight goes to 24.0 to 30.0, that is considered as overweight, and anything above 30.0 is considered as obesity. As we mentioned earlier, reducing weight is an uphill task, but it is possible to do it. Therefore, you and me may need to modify our weight to keep it within the body mass index, or what is considered as normal range, in order to avoid damage to the joints and also to avoid diabetes. It is good for you and me to reduce our sugar in foods. For example, reduce sugar in your tea if you are not diabetic, but if you are diabetic, then sugar-free diet. If possible, just completely do without sugar, because sugar is key in weight, and sugar is key therefore in causing a person to remain with an extra weight which will damage the joint. It is better to eat traditional foods than the highly refined foods, because the traditional foods are high in fiber and low in fat, For example, the sweet potatoes, the arrowroots, the wholemeal bread, wholemeal chapatis, and ugali made from uga number 2, wimbi, sorghum, oatmeal, and other high-fiber cereals which are available in the supermarket. It is good when you serve food for you and me to use more vegetables in food than the carbohydrates and the proteins. It is good to reduce the amount of protein and carbohydrate amount in the food you and me eat, especially if you and me are already senior citizens or having an issue of overweight or obesity. Use more fruits in your diet, but remember, bananas are more of carbohydrates than fruits because of what they contain. Sometimes you and me can be tempted to have a second helping, but it's good to avoid a second helping in food and eat small amounts so that we can keep our weight down and avoid osteoarthritis. How is osteoarthritis managed? Treatment and management. One is making a diagnosis. Diagnosis is made by physical examination of a person and examining the joint and noting the findings. The other is an X-ray is done. The X-ray will be able to show the changes that have already occurred in the joint. Those are notable for the diagnosis of the osteoarthritis. An early diagnosis and early treatment is important in order to slow the progress of the disease osteoarthritis. That also helps. An early diagnosis and early treatment also helps to optimize the function of the joint so that it is not damaged very quickly. Exercise can improve the strength to the affected muscles of the area surrounding the joint, and they help in joint mobility so that the joint is not damaged very quickly and one can continue to use the joint. Medicines are given, but mainly to reduce the pain and to reduce the inflammatory effects that cause damage to the joint. Surgery can also be done. Surgery is done to replace the damaged joint, reduce pain, and restore movement. Most surgical interventions for osteoarthritis are done on the hip joint and the knee joints. Therefore, if you and me are able to maintain a weight within normal body mass index, that will also help to keep the weight down and therefore help to reduce damage to the already affected joints. The other aspect of treatment and management is patient education. You and me need to be well informed on osteoarthritis so that we can be able to cope with the changes that occur. And also, the other important people who need to be helped to be informed on osteoarthritis are the family members and our close friends that we live with. Daily exercise is important so that we can be able to continue to keep the joint active and functioning. Daily exercise can be done half an hour after taking the medicine for pain because it is painful. When you plan to do an exercise, if you take the medicine for pain half an hour before, that gives you an opportunity to be able to do exercise when the medicine is helping you to reduce pain. The other is to continue medical checkup with your doctor so that he can be able to help you to continue to have a better quality of life despite osteoarthritis. Osteoarthritis affects the quality of life, as we mentioned earlier, and affects the mental status. Therefore, it is good for you and me to continue to maintain our social contacts. It is good now we can be able to communicate on WhatsApp, on the phone, and therefore, when we maintain those contacts, it is good and healthy for us to continue to communicate with our friends and other important people in our lives so that we maintain our contacts and maintain better mental status. Osteoarthritis makes movement difficult and painful, preventing a person from being able to participate in social activities such as weddings or going to church and other social activities. Therefore, it is important for us also to plan well so that we can be able to attend social activities, because if you and me have a problem with your osteoarthritis and not able to participate in social activities, then lonely can set in, which is also not mentally healthy for us. Sometimes people can use some devices to support the joints so that they can be able to make life a little more comfortable in cases where the joints have been damaged. Heat applications are also soothing to the joint when they are painful. Those can be applied. The patient can also join a group where similar people have the osteoarthritis. Then that gives you and me opportunity to discuss with the people who have a problem. They can share their experiences and how they are coping so that we can be able to benefit from sharing with them. Therefore, apart from keeping contact with your normal social contact, it's also good for you and me to have contact with the people who have a similar disease, osteoarthritis, and that will help you and me to be able to benefit from their experiences. Osteoarthritis can be prevented. How can you and me prevent osteoarthritis? One is to reduce overuse of the joint. Avoid overweight, avoid obesity. We have already talked about it. Try, by God's grace, to keep your weight within normal body weight or within the body mass index, normal body mass index. Promote a healthy lifestyle. Have regular activities. For example, walking. Walk about half an hour per day. And when you are walking, it is good to wear well-fitting shoes which are comfortable so that you don't get into injury when walking. Some of the areas you walk, it is good to know or select an area where you know that it is easy to walk and avoid injuries. The other factor is to maintain a healthy diet. It is good for you and me to select foods which are rich in phosphorus, which is good for healthy bones and strong bones. Phosphorus is a mineral which is important to keep the bones healthy. Foods which are rich in phosphorus are, for example, the egg, the fish, meat, chicken, dairy products such as milk, peas, beans, nuts, like our jugu karanga. Those are foods that are rich in phosphorus. Remember, it is good to eat in small amounts because your body needs small amounts each day. If you eat extra helpings, they may result in weight gain or add cholesterol to your blood, which may not be very good. The other is drink soup, especially bone soup. When you prepare soup, keep it cold. Allow it to become cold overnight so that you scoop off the fat in the soup, because you and me do not need that extra fat. We only need the phosphorus in the soup. So you can make soup in your own home. It is more healthy. Sometimes the soup prepared in other areas has fat, which may not be good for your health. That brings us to the end of osteoarthritis. I am available for any questions or comment that you may have. Thank you for listening to me. I appreciate your listening. God bless you.